Let's talk about sex. There are very few individuals that are trained to talk about sex or trained to treat abnormalities or problems with sexual function. It's because it needs to be a multidisciplinary approach. Namely, it can start with one type of practitioner, but sometimes the problem needs to be refocused to another type of practitioner. I'll give you an example. Mrs. Smith has a problem with her hormones, and it presents as having very low sexual desire. It turns out we fix her hormones and she's perfect in that regard, but then it comes out that she really doesn't like her husband very much, and what she really needs is a marriage counselor. Those kinds of things happen every day. But more importantly, it's critical for someone to be able to explore all the different avenues in one place in order to really determine what the issues are. Sexual dysfunction, what we call all the different problems of sex lumped into one thing, really is disorders of or absence of desire, loss of libido, so to speak, decreases in lubrication with arousal or genital tingling and swelling in women, and that's arousal. And then we have the whole issue of orgasm, yes, no, and if yes, is it what she expects, or it can even be painful, or muted, or taking so much time and energy that she rarely gets there. Then there are all kinds of disorders of sexual pain. Pain with penetration of the vagina, pain with deep pressure, all kinds of pain. They can be external, internal, or anywhere in between. It's really critical that someone who's an expert on female sexual normal function be the one to determine whether a particular person has a dysfunction or abnormality, because we don't have good norms for a lot of these things. For example, what's normal for a 50-year-old in terms of how often she should be having sex? It's not such an easy answer. Maybe her husband travels 3 weeks out of 4. She has a different answer than if she and her husband are there together all the time. So determining what's really normal for her and whether or not she has a problem or not is the first step to making a proper diagnosis and then a proper intervention. In the past, we had few or no treatments for any problems in sexual medicine. Not for him, not for her. But much has happened since the advent of Viagra more than 14 years ago. Lots of scientific funding and resources have gone into understanding and treating sexual function and dysfunction, as I've described it, in both men and women. And there are a number of pharmaceutical, device, and other treatments for common sexual function problems that oftentimes get glossed over because sex is embarrassing, or she or the doctor don't bring it up, or any number of issues that are barriers to getting the problem solved. We are also doing a lot of research into new treatments for sexual function problems like low libido or poor arousal that hopefully, if the research goes well, will become the next round of effective treatments for women's sexual health. One of the more exciting developments in women's sexual health was the development of what's sometimes called the pink pill or the female Viagra. It has a real name. It's called Addy. Even though I just referred to Addy or flibanserin as the pink pill or the female Viagra, I think we need to make some distinctions. Viagra, Levitra, Cialis, and other medications for men in that category are used on demand, that is, at the time of sexual encounter, and they improve blood flow in the case of men to the penis in order that he have a better or any erection. The pink pill, Addy or flibanserin, works differently. It works by taking it on a daily basis, and it works in a woman's brain to change her brain chemistry away from negative thoughts or no thoughts or feelings about sexual interests or activities to positive, pleasant thoughts about sexual encounters and activities. If a woman and or her husband are having sexual difficulties, one of the biggest barriers is to swallow your pride and come and ask for help. Many times it's just an issue of counseling or some kind of mindfulness training or behavioral therapy. Sometimes medications, even surgeries are what's indicated. Sometimes it's some combination of many different approaches. And we're open to all of them and have used literally all of them at one time or another.